part 2 of exam 2 review for adult care at ETSU nursing. Yes. Okay. Diabetes, guys. Diabetes. All right. We're going to go over some pathophysiology here. We have type 1. So it's type 1 diabetes is an autoimmune disorder where there is destruction of the beta cells. No insulin, guys. No insulin. Okay, that's really sad. So, you have to be taking insulin regularly. Type 2, you didn't hear this from me, but basically bad lifestyle, obesity, organic foods, oils, not exercising, watching TV all day, not following Jesus. I'm just kidding. So anyway, all that leads to your body being like, you have too much sugar in your body, and so your body's like, I am done. Okay, so you have this thing called insulin resistance, where your body makes all this insulin, but your body refuses to use it. So there's beta cell dysfunction. And so you basically have to take a drug that overrides the body's natural insulin resistance. You can also become insulin dependent even if you're type 2 as well. All right, so some type 1 risk factors are genetics and also viral infections. All right, so type 2, like I said, obesity, sedentary lifestyle, family history, it says, but that's usually because of nurture, in my opinion. And then also hypertension, which is basically caused by sedentary trash lifestyle. All right, so type 1, autoimmune, it has a sudden onset. It's insulin dependent, like I said. Type 2, insulin resistant, it has a gradual onset. It's lifestyle related. So just live a good lifestyle, like eat healthy, organic, whatever. No carb. And if you don't eat carbs, you almost can't get type 2 diabetes. Like, I don't even know if that's even possible. I don't know. I'll let you know. Because I don't eat carbs very much. Okay, so now we have metabolic syndrome, and the criteria for that is usually obesity, hypertension, high triglycerides, low HDL, high blood glucose, and that's basically like on your way to type 2 diabetes. Okay, so diabetic foot care. We want to inspect that foot daily, no barefoot walking. You want to wear proper shoes, check inside your shoes, keep your shoes dry, all that fun stuff, okay? All right, so some labs. So for pre-diabetes, we want our A1C lower than 5.7 to 6.4. Or, sorry, my bad. If to be diagnosed with pre-diabetes, you need an A1C of 5.7 to 6.4. And then you need a fasting blood glucose of 100 to 125. For diabetes, you need a fasting blood glucose of greater than 126, and then your A1C needs to be greater than 6.5%. All right, this is where it's going to get me. For reals, guys. Okay, so this is insulin onset, peak, and duration. And this literally gets me, okay? I don't even know how I'm going to memorize this. Hey, the one person that's currently watching, if you have a trick for this, please comment down below, because I literally don't know how to memorize this. All right, so we have rapid insulin. Rapid is Lispro or Aspart, and it takes the onset's about 15 minutes. The peak is an hour, and the duration's 3 hours. Okay, that's for rapid. All right, so short acting, which is regular insulin, is 30 minutes. The peak is 2 hours, and the duration is 6 hours. Intermediate, which is NPH, that lasts the peak onset is 2 hours, the peak is 6 hours, and the duration is 12 hours. And long acting, which is glargine, onset is 2 hours, there's no peak, and the duration is 24 hours. All right, insulin administration. You want to rotate sites, don't massage it, and then clear, and then cloudy. So regular regular is clear, and then intermediate is cloudy. Okay, so if you're not monitoring your blood glucose every 4 to 6 hours, then you want to monitor it before you eat, at bedtime, if you're sick, or if you have symptoms of hypo or hyperglycemia. All right, now we're going to go over some oral diabetic meds. These are mostly for type 2. We have metformin, and make sure you stop that before you take contrast dye. For, I think it's 48 to 72 hours, 24 to 48, something like that. I don't know. Hopefully it won't be on the test. All right, so metformin, you also have a lactic acidosis risk. And then also you have your sulfonylureas, like glipizide, and that has a hypoglycemia risk. So just be aware of that. Alright, so blood sugar with sick or hospitalized people, you want to be monitoring that every 4 hours. Stay hydrated. Continue insulin as needed. Alright, some diabetic complications. We have retinopathy. So blindness risk and annual eye exam. A way to prevent that is to just stay on top of your blood sugar. Alright, we have neuropathy. So proteinuria. And monitor kidney function. Oh, sorry, nephropathy. My bad. That can cause proteinuria, and you want to monitor the kidney function. And then neuropathy, which is numbness in the extremities. Make sure you do that foot care. And then, oh my gosh, what was I reading on something about that and how to help? I'll have to go back and read that because I don't remember. But it was something on if your patient is experiencing neuropathy and they're diabetic and what you should do, and I don't remember what that is. Alright, hyperglycemia symptoms. So hypoglycemia, remember, cold and clammy, eat some candy. So that's hypoglycemia. We have sweating, tremors, confusion. Also, just FYI, a cup of milk is 15 carbs. Yeah, good to know. Also, hypoglycemia is considered, or you're considered hypoglycemic if your blood glucose is below 70. Treatment is taking glucagon or juice or a cup of milk, apparently. All right, hyperglycemia, so type 1 diabetes is DKA, diabetic ketoacidosis, and then type 2 is, oh my gosh, I forgot. It's HHS, but I forgot what it stands for. Oh yeah, hyperosmolar hyperglycemic state. So that's for type 2 diabetes. So DKA, you're going to have ketones. You're going to be in metabolic acidosis. You're going to have Kushmol's respirations. Treatment is give insulin and also fluids. And then HHS, you're going to have no ketones, severe dehydration, and then also just give insulin, give fluids. Because remember, they're dehydrated. All right, diet and exercise. So we're going to teach patients about carb counting, how to read the back of labels, consistent meals and like counting, and then also avoiding sugar because that's just more carbs, okay? So exercise lowers glucose, but don't exercise if your blood glucose is greater than 250 if you have ketones, which is super random, but you're welcome. And, wow, that one was actually pretty short. And that is all that I'm going to talk about for now about diabetes. So thanks for tuning in, and good luck on the exam tomorrow. Bye. Jesus loves you.